you to complete breath in. I got you. Exhale. Let all the air out. Good. All right, other side for me. Okay.
Oh.
There's no more one-legged get it in your car.
Nah.
Those days are over. I know it looks really cool. Right?
Yeah.
You know, it's got to be beep, 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 beep.
Oh gosh.
Do you understand? Right? Doesn't look that cool though.
When I sit for a long time at work, so I'm sitting all day, but if I like go overtime and I'm sitting longer, I get I can't describe the pain, but all up this side of my back.
Okay.
And it burns and like hurts really bad to where I have to leave. I can't stay any longer.
Does it go down the leg or into the glute? Just stays there in that left side of your back?
It stays there, yeah, it just shoots up from here up to here probably.
Okay.
Normally it's like, it stays up in here. I did like 2 weeks ago, I lay on this hard ball.
Okay.
And it caused like me more pain actually. I started getting shooting pain up into and stabbing pain into my knee.
Did you place that right on your lower back? Where did you place that?
I place it, so I put it, I feel like it's on the bone, like right here.
Right.
And then I put it, you know, in different spots here.
In the past, where have you experienced numbness? Has there been numbness in your leg? Or
It
where?
goes down to my leg and my foot. Actually, driving here, I did, you know, it starts feeling numb in my foot.
The whole right leg or just the foot?
My right leg.
Okay. Whenever you're dealing with radiating pain, what we call space-occupying lesions, something's occupying a space that shouldn't be occupied, and very likely it's a disc, and really the only way to see that is MRI.
Okay.
They really shouldn't be taking x-rays for that when we know that there's radiating pain.
Dang.
The local pain is joint, so most likely it's the joint in your back is inflamed. When you're sitting, the joint expands and swells, and that causes it to burn, and you'll get some radiating pain in the area. Joints are not as expensive as discs. Discs are one of the most valuable structures in our spine. They don't replace. So whenever just local pain, I put on a sort of a lower tier of importance, and when we involve radiating or numbness, I sort of bring that up to a higher level of we need to educate and know what's going on here. This is a more serious thing than just, you know, some joint pain and some inflammation, some facet syndrome we call it. You know, you're 30 years old, I expect to see a 30-year-old MRI on a picture. What I generally see is parts of your spine look older and parts of your spine look younger because part of your back is being overburdened and that area starts to age more, and then part of your spine is not working at all and that part isn't aging, and that imbalance is what's causing the pain. Hip height misalignment happens. Let me look at your hips here real quick. You're fine. So on x-ray you said that the previous chiropractor noted that your hips, so this left hip is high.
It bothers me really bad when I walk.
And that's, well, and
I feel stuck on this side.
Can you see that, Karan? Can you see? So her left hip, look just at my top of my hands, this hip is about inch to half inch to inch higher on her left. What's happening is your left hip is coming up to alleviate pressure on the right. So we call this antalgia. This is I'm exaggerating a little bit, but you see how this, when you tilt to the left, the holes on the right get larger. It's an avoidance pain. It's like if I break my right leg, I'll shift my weight to my left side to get away from it. To directly undo that is silly because your body's intelligently trying to open up these little holes that the nerves go through to alleviate pain. Does that make sense?
Yeah.
We have to get rid of the reason for why there's a disc injury in there. That needs to be understood, and that disc injury is going to cause avoidance. So how do we help the disc? We have to take some of the stress off that disc by two ways: getting another part of your back loosened. When you sit, your middle back gets really tight, so all the movement happens at the bottom. Does that make sense? And then there's supposed to be a curve in your back that goes straight when you sit. It's like a ladder, all the weight's going down to the bottom part of your spine. So we want to first loosen up your spine and then work on that arch that's supposed to be in your back. But the left, this gets really silly really quick because if my left hip comes up to alleviate pressure on this, and then one chiropractor takes the left hip and pushes it back down, then I run into the nerve again.
Oh,
You see that?
Yeah.
When I tilt to this model's left side, watch the holes on the right.
Okay.
See how they get bigger? Right, so we call that antalgia. You can, the holes that the nerves go through change based on biomechanics. It's also based on the size of this spacer. Right, so the thickness of the disc holds open the foramen that the nerve passes through. So when you're dealing with leg pain, you got pressure on this nerve. That's what's causing it. You have irritation of the nerve root. So this model's trying to show here a disc injury where the disc's coming out and putting pressure on the nerve there. Okay. So if I lift my left hip up, it makes the holes on the right get larger. That's an avoidance. Then if I push the hip back down, I'm going to close down that hole and I'm going to pinch that nerve. So it's a little silly, right? So I don't ever directly undo antalgia. Ed, I want the hip height misalignment gone. The hip, I'll fix it, but the way we fix it isn't by directly manipulating the left hip high. I see it. I see your left hip's high. It's high because, Ed, I got radiating pain down my leg. It would actually be worse if your hip wasn't high. Okay. Does that make sense? It's like you'd be pinching it more, yes. Right? Okay. It's like if you broke your right ankle and got your weight on your left ankle and your right ankle's still hurting and you're not even barely working on it. Does that make sense? Mm-hmm. So that tells me, obviously, you've been dealing with this for a couple of years. Your body's had time you're in antalgia and you're still in pain, right? So usually sometimes, for instance, somebody will have a whiplash. They have some initial pain during a car accident, their head goes forward, I feel fine, right? Because they're in avoidance. Does that make sense? Okay. And then because a person after a car accident heals with their head forward 5 years later, now my neck kills me. And then I have to be the bad guy and say, well, the accident caused the posture change, which now caused your pain. It was the accident that caused this, but because nobody analyzed your posture and nobody cared to say, look, here's where you were before your accident, here's where you were 6 months after your accident. Does that make sense? You're in avoidance and then you healed in avoidance. Or say you have an injury and then you go to work and you're sitting as a receptionist and so you healed here. Does that make sense? This is not where you belong. Right. This is not a neutral position. This even trying to sit up, this is still flexed. I'm flexed at the waist.
I did forget one thing. I don't know if this could have been the cause of it, but when I was like 18, I was crowd surfing at a Warped Tour, and I got dropped right on that spot. Right. I went down like that.
Sure. If this part of your back is the loosest part of your spine before you were crowd surfing, and then you fall. No, it's okay. I've heard weirder stuff. Crowd surfing.
Back in the heyday.
Before you were crowd surfing, this part of your back was probably the loosest, and then any injury to it further sort of damages the supportive internal structures like a ligament. And so now there's a little bit of instability. You'd have to do a motion study to be able to see it, like take a picture of you bent forward, take a picture of you bent back. Does that make sense? If they just take a neutral picture of you, it's probably not enough to see it. I'm going to leave this area alone. It cannot be helped.
I've noticed that. There was another lady I watched, and you kind of steered clear of it.
You can't.
So, whatever. I want to solve the problem, and I trust that you know how.
How about this? The simplest way I'm explaining it. We get this moving. This area moving takes the pressure off this. The pressure being off your lower back makes the hip come back down because the disc's no longer injured. Your body will undo that antalgia when it no longer needs to be there. Your body is purposefully and intelligently raising that left hip because you have nerve pressure. Take a deep breath in for me. And exhale for me. Let all the air out. Let the air out. There you go. There you go. Beautiful. Deep breath in. I got you. Exhale. Let all the air out. Good. Deep breath in. Good. Okay. All right. Exhale. Good. Perfect. Put your head, back of your head sort of right in that little slit. Perfect. Take one deep breath in for me. And then exhale. There we go. I got you. All right, other side for me. Okay. Now real loose down there. Deep breath in. Exhale.
Oh my gosh.
Where?
It feels like it's not going to go anywhere.
It's okay. There. I'm done. We're good. Face up for me. Okay.
It didn't hurt.
Okay. Okay. I'm not going to go any harder than face. You're doing good. Right about there, your bones are level. Dang. But I tilted you 20 degrees to the right to make your bones level. I want your bones level at the same time your head's straight with your torso. So essentially your head's tilted left all the time, and because your head's tilted left, you're going to overwork the left lower part of your neck.
It is tilted left all the time.
I know.
I actually feel it.
I know. It's okay. All I do is look at necks all day long. I can't hide anything from me. Again, nobody cares until there's smoke coming out of the hood. Yeah. Does that make sense? I'm looking at you from a long-term perspective, crystal ball, saying, look, your neck is not aligned up here. You're going to age the left lower part of your neck at a faster rate because this is crooked. do we want to just wait till symptoms, or try to address it preventatively?
Yeah.
And that's what I do for a living. There we go. Let it all go. Chin up. There we go. Very good. You okay?
Dang. Yeah.
I know. You're real gentle. This side will be easier. Let it go. Chin up. Let it go.
Oh.
All right.
Dang.
Give it a second. Yeah. I know. It needed it. It's been a while. Is it a year since your last adjustment?
Yes.
Yeah. Okay. All right. There we go. We want to just get your neck arched back. Here is where you belong. Wow. I know. There we go. And I got pretty strong thumbs, and it feels like I'm out in the parking lot, pushing on concrete. That's a lot of resistance. There's going to be some marks up here. There's going to be some marks.
Yay!
It's really at the top. It's just a little congested. When the mobility of the area is actually what keeps it clean. So when an area gets tight, it doesn't self-clean itself internally. And that's what produces the stagnation that creates the mark. Right there. Should feel pretty warm after this. It's just getting a lot of blood to rush into this area, take some of the soreness and lactic acid out of here, the congestion, and then every visit we sort of walk up this ladder of improving the mobility of that area. This is the other end of that same muscle. So the same muscle that attaches there at the top, the roots of that muscle are here in your shoulder. Right there is that's the same muscle, but it's the root. Think of the neck as like a trunk of a tree. The more the tree leans over, the more the roots come out of the ground. You can rub these forever and ever, but if you don't take the tree and bring it upright, does that make sense? It's kind of silly. I just want to stand the tree upright. And you won't have to sit here and rub this all the time. Yeah, okay, there we go. Right there, yep. It's kind of right above the brassiere, right on the brassiere. That's where the most congested area is going to be, and where the most lactic acid is going to be, stagnant, stuck in here. Right there. So with the right leg neuritis and nerve pressure, it's actually the left middle that's the most responsible. So the left middle is tight, the left lower is mildly tight, the right lower is abused. And so the disc's probably more aged on the right lower than it is on the left lower. There we go. Right, you give this another 10 years, you wouldn't have, all these joints would be locked. Does that make sense? These would all just be, wouldn't even get any mobility on that thoracic adjustment. So it's good that you're here now. We're going to prevent all that.
So gnarly.
There you go. right there. It's all right there.
It's like a washboard.
Yeah, yeah, yeah. Well, 8 hours, 10 hours sitting is gonna. It's really lifestyle changes a little bit, and then some things I can teach you about when you're sitting, what we can do to reduce some of this buildup in here. How quickly the marks come out sort of tells me how much is in there. Kind of the first pass with a vacuum cleaner. If you start hearing a lot of sounds, oh geez, somebody must have walked in with their shoes on. Anyway, so just how dirty it is. This is what's causing that burning pain. There's just, so you have two joints in here. You have the joint between the vertebrae, and then you have the rib head that attaches to the side. So you have a lot of mouths to feed in here, a lot of things that can cause that burning or localized pain in here. I'm in a lose-lose situation here. I can't, if I push on the area that's injured, I hurt you. And if I push on the area that's stiff and make it work, and that doesn't feel good either. So it's sort of a process to, it's like an orthodontist. An orthodontist is in a lose-lose situation, right? Either doesn't move your teeth and you're upset with him, or he moves your teeth and you're upset with him. There's no, it never feels good to have your teeth moved. It felt delightful to have these wires put in my mouth and brackets glued onto my teeth, and right, but you thanked him after 2 years and said, thank you for putting me in a better alignment for long term, and sort of the same idea here. It's there's a posture change that needs to happen.
You look good in purple. It feels fine. It wasn't what I expected.
It shouldn't hurt. Yeah, it's supposed to. It should be after the elbow. It's like, oh, this is nice. There's not supposed to be any. Now tomorrow morning it's going to be tender because we've sort of broken loose any adhesions and glue that's inside, and at night times when your body goes in there and washes it out. So, is it, how far down, when you feel numbness, is it top of the foot, big toe, little toe? Can you give me more specifics on exactly where? Hard to tell.
No, it just kind of disperses. It just feels like a lack of, like I'm not getting blood flow. Okay.
To the whole foot, but it feels like the whole foot. Okay.
It down to my toes, all of them.
Okay. So, I'm just trying to differentiate between L5 and L4. So 99% of back surgery is the last two guys. So, sometimes it'll be a little different if we're hitting L4 or L5, but in this case, it's most likely L5 that's being hit. And so right sort of at your waistline is where we're going to ice in a minute.
I'm really surprised that actually feels good.
But yeah, that's the joint right there. All right, I'm not trying to overwhelm you. Here we go. And he was nice, and then he got all mean. All right, I got you. There it is, good, I know. Yeah, I loosened it up and it moved a little better. All right, okay, all right, yeah. There's more right there.
Dang.
I know.
Oh yeah, I feel it.
Let's see if we can stretch it in a little bit. Here we go. Let it go. Oh. All right, okay. All right. Good, okay. I know, yeah, that's the one. Okay. Hold on, bring your arms above your head and sort of hold on the table. Yep, I got your leg. Let me have your leg, I got you. There we go, good, I got you. Here we go. Here we go. Okay, had your ear adjusted and we'll check it. There we go, okay. All right, tilt your head to the left a little bit for me. Oh, yeah. Tilt your head left for me. There we go. Okay. Tilt your head to the right for me a little bit. Yeah, it's pretty loose. Okay, good. Let me have you put your hand on your hip for me. I'm just going to check your shoulders here for a second. Sort of press back with your elbow here. There we go. Good. It's okay. Just checking them. They're already loose. Sort of press back with your elbow. There we go, yeah.
I go like this, and I'm laying down, and it just cracks all in here. Is that part of just all the problem?
Do you feel like it's the hip socket? Where do you feel like
it's in there? I could probably do it. Oh.
So it's the hip socket. You feel like...
Sometimes
is
it's
it repetitive? Is it repetitive?
Crazy.
Can you repetitive it?
Oh, yeah.
All right, what you're dealing with is the tendon going over a bone. Does that make sense?
Yeah.
You should be able to have your knees, like, you can't,
That's
I don't feel anything. They shouldn't be up here.
Okay.
They're going to click if you're not able to get, you know.
I don't know if that's possible.
Show me.
Kids.
I'd be curious if you could work on that. You understand, working on just if you open up that stretch and see if that changes. I'm not, in terms of the health of anything.
Never hurt or anything.
I'm not worried about it. It's most likely a tendon cable that's tight. See, if the cable's loose, it doesn't pop over a bone. When the cable's taut, now you can, like a guitar string. So why is the cable so tight? Well, the hips are rotated forward because you're sitting for 10 hours. Mm-hmm. So it sort of goes in line with
that's what I kind of thought.
The story that's of Ed, I sit for 8-10 hours, plus a car, plus children. You know, it's too much time forward. How are you in an area where there's a lot of people looking at you?
I mean,
how private are you?
Girls. We're a small office, very small.
It's just not, this is not the most professional way to sit.
Oh, I don't care.
You see what I'm saying?
Like family in there.
Right. Like, you see my butt sticking out, and you know, it's not. Well, what are you doing? This is. You can sit like this for a long time. If you can't sit backwards like I just showed you.
Oh.
Does that make sense?
Yeah.
You keep some arch. Like when my wife and I were driving our car to North Carolina, we sort of handed it back and forth every couple hours. Mm-hmm. After 2-3 hours of me sitting in the car, stuck in this position, I started getting some pain in my hip. Mm-hmm. You know, it's not. I get adjusted 5-6 days a week. It's like adjustments aren't enough to just solve bad posture. You have to try to restore some of that curve that we lose being stuck in a position. That makes sense? You put your belly onto that backrest and you try to arch.
It's actually comfy.
Right. Mm-hmm. Rest of your life. Rest of your life. And then you sit like this for a half hour and something, your hip starts to ache, you change. I mean, I'm not saying you can stay here for 8 hours, but do it for 2 hours or see how long you can handle it. No more one-legged, get it in your car.
Yeah.
Those days are over. I know it looks really cool. Right?
Yeah.
You know, it's got to be beep, 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 beep.
Oh my gosh.
Do you understand? Right? Doesn't look that cool though, right? You know, but you really should open your door.
Gone a long while ago.
Right, but you open the door. Beep, beep, beep. Put your butt down, you sit down. Especially your car, you have a regular car, it's pretty low.
Mm-hmm.
So, yeah, there's no, if you had an SUV, you just kind of get away with the one leg getting in her.
And that's how I do.
But if it's a car, yeah, and you're doing, oh yeah, it's going to click every time. I mean, once we clean everything and make things better, you probably can get away with it. But if we're in, I got burning pain, I got radiating,
yeah,
you know, that's a pretty stressful thing to do to your back. My usual protocol is a couple visits, no stretching, and then we start introducing this. When this becomes easy, we move to the Denneroll.
Awesome.
All right, very good.
Cool, thank you. I keep watching you. I'm like, oh wait, okay.